Good evening. Welcome to another edition of the 411 Talk Zone radio show. My name is Leon Jones. Tonight's topic is going to be another mental health topic, and I'm going to talk about gender dysphoria, treatments, diagnosis, and the challenges. Because when you get into gender dysphoria, this is when you talk about becoming another gender. In other words, if you were born a male, you want to become a female. Now, gender dysphoria involves a conflict between a person's physical or assigned gender and the gender in which he or she tends to identify with. Now, people with gender dysphoria may be very uncomfortable with the gender that they were assigned. And what I mean by assigned, they were born as. They may be uncomfortable with being born as a man or a woman. Typically, let me get a little technical, a boy or a girl. Then you grow into a man and a woman. Now, sometimes described as being uncomfortable with their own body, particularly when it comes to development during the puberty stages, or being uncomfortable with the expected roles of their assigned gender. Now, people with gender dysphoria may experience significant distress and or problems functioning associated with the conflict, the way they feel and think of themselves, or referred to as experience or expressed gender, and their physical or assigned gender. The gender conflict affects people in different ways. Now, it can change the way a person wants to express their gender and can influence behavior, dress, and self-image. Now, some people may cross-dress, some may want to socially transition, and others may want to medically transition with the sex change operation or sex change surgery and or hormone treatment. Socially transitioning primarily involves transitioning into the affirmed genders, pronouns, and bathrooms. Now, people with gender dysphoria may allow themselves to express their true selves and may openly want to be affirmed in their gender identity. Now, they may use clothes and hairstyles and adopt the first name of the experienced gender. Similarly, children with gender dysphoria may express the wish to be of the opposite gender and may assert they are or will grow up to be of the opposite gender. They prefer or demand clothing, hairstyles, and call the name of the opposite gender. Medical transition is only relevant at and after the onset of puberty. Now, gender dysphoria is not the same as gender nonconformity, which refers to behaviors not matching the gender norms or stereotypes of the gender assigned at birth. Now, examples of gender nonconformity also referred to as gender expansiveness or gender creativity include girls behaving and dressing in more ways socially expected of boys or occasional cross-dressing in adult men. Now, gender nonconformity is not a mental disorder. Gender dysphoria is also not the same as being gay or lesbian. While some children express feelings and behaviors relating to gender dysphoria at 4 years old or younger, many may not express feelings and behaviors until puberty or much later. Now, for some children, when they experience puberty, they suddenly find themselves unable to identify with their own body. Some adolescents become unable to shower or wear a bathing suit and or undertake self-harm behaviors. Now, when it comes to diagnoses in adolescents and adults, gender dysphoria involves a difference between one's expressed or experienced gender and assigned gender, and significant distress or problems function. Now, it lasts 6 months and is shown by at least two of the following. Now, you have a marked incongruence between one's experienced expressed gender and primary and or secondary sex characteristics, a strong desire to be rid of one's primary and or secondary sex characteristics, a strong desire for the primary and or secondary sex characteristics of the other gender, a strong desire to be the other gender, also a strong desire to be treated as the other gender, and a strong conviction that one has the typical feelings and reactions of the other gender. Now, in children, gender dysphoria diagnosis involves at least 6 months of the following and an associated significant distress or impairment in functioning that lasts for 6 months. A strong desire to be the other gender or an insistence that one is the other gender. A strong preference for wearing clothes typical of the opposite gender. A strong preference for cross-gender roles in make-believe play or fantasy play. A strong preference for the toys, games, or activities stereotypically used or engaged in by the other gender. A strong preference for playmates to be of the other gender. A strong rejection of toys, games, and activities typical to one's assigned gender. A strong dislike of one's sexual anatomy. A strong desire for the physical sex characteristics that match one's experienced gender. Now, for children, cross-dressing behaviors may start between the ages of 2 and 4, at the same age at which most typically developing children begin showing gender behaviors and interests. Now, gender atypical behavior is common amongst young children and may be part of the normal development. Children who meet the criteria for gender dysphoria may or may not continue to experience it until adolescence and into adulthood. Now, some research does show that children who had more intense symptoms and distress, who were more persistent, insistent, and consistent in their cross-gender statements and behaviors, and who used more declarative statements such as I am a boy or girl rather than I want to be a boy or girl, were more likely to become transgender adults. Now, with any mental disorder, there is also treatment options. There are also treatment options when it comes to gender dysphoria. Now, treatment options for gender dysphoria include counseling, cross-sex hormones, puberty suppression, and gender reassignment surgery. Now, some adults may have a strong desire to be of a different gender and to be treated as a different gender without seeking medical treatment or altering their body. They may only want support to feel comfortable in their gender identity. Others may want extensive treatment, including hormone treatment and gender treatment surgery, leading to a transition to the opposite sex. Now, some may choose hormone treatment or surgery alone. Individual therapy can help a person understand and explore his or her feelings and cope with the distress and conflict. Now, couples therapy or family therapy may be helpful to improve the understanding and to create a supportive environment. Now, parents of children with gender dysphoria may also benefit from counseling. Peer support groups for adolescents and adults and parent-family support groups can also be helpful. Now, a child's treatment typically involves a multidisciplinary team of healthcare professionals, which may include a pediatrician, a psychiatrist, other mental health professionals, and a pediatric endocrinologist, which that person specializes in hormone conditions in children, and, of course, an advocate. Now, treatment may focus primarily on affirming psychological support, understanding feelings, and coping with the distress, and giving children a safe space to articulate their feelings. Now, for many children, feelings do not continue in adolescence and adulthood. Now, a person may also address social and legal transition to the other gender. Now, unlike any other mental illness that I've talked about in my videos, this one has a little bit more challenges and complications. because gender dysphoria is associated with high levels of stigmatization, discrimination, and victimization, contributing to negative self image and increased rates of other mental disorders. Now, transgender individuals are at a higher risk of victimization and hate crimes than the general public. Adolescents and adults with gender dysphoria are at increased risk for suicide. Now, in adolescents and adults, preoccupation with cross-gender issues can interfere with daily activities and cause problems in relationships or in functioning at school or work. Now, children, on the other hand, with gender dysphoria may experience teasing and harassment at school or pressure to dress more like their assigned gender. Of course, children with gender dysphoria are at higher risk of emotional and behavioral problems, including anxiety and depression. Now, transgender individuals may also face challenges in assessing appropriate health care and insurance coverage of related services. And that's my commentary for this edition of the 401 Talk Zone radio show for this evening, Hump Day, Wednesday, June 14th, 2017. You can tune into the 401 Talk Zone radio show every Saturday from 6 p.m. to 8 p.m. on Blog Talk Radio. And I'm going to get more into this topic on a Blog Talk Radio show. Not going to be this weekend because I'm going to talk about men and how they need to assess their own wealth and worth. So you don't want to miss that show. The guest calling number is 215-383-5785. And if you like my videos, please share and subscribe to the 401 Talk Zone radio show right here on YouTube so I can continue to give you quality information for educational purposes from a professional and mature perspective. Now, on this channel, I don't engage in debates, controversy, and I don't do a number of emotional issues because one thing I noticed, particularly in the African American community, they're not into learning truth. They like the drama. And because I'm an African American, most of the videos that I do are in the African American community sector of YouTube. And this is why I don't engage in any drama or unnecessary bickering. Because my channel, I'm just here to give you education. Because knowledge is power, but what I'm giving you is realistic information that is powerful and it is positive. The bottom line is you must be interested in this education and understand this education, because what I described tonight is very real. But a number of us, particularly in the African American community, aren't really interested in education at all. But I guarantee if I started cursing and putting up a lot of negativity about black women or black men, people will be coming to this channel, subscribing like it's going out of style. But I'm not going to do that. Because again, I want to educate people on this channel, give them the tools to help them understand how the real world works. Because if you don't understand what's going on around you in the real world, you're going to be lost. And your life is going to pass you by because you're going to be constantly misinformed, and your mind is going to be filled with a lot of indoctrination from sources that are going to be very negative. So I just want to put that caveat in there so everybody can understand what my channel is about. My channel is an education channel. I speak as if I am a professor who has a class because I want individuals to get a grasp of the material that I am presenting, because it is very important. Because whether you like it or not, some of you have mental issues. And if you don't, there are people with mental issues who are around you. You look at the guy that shot those 9 people in Alexandria, Virginia. Don't tell me that guy didn't have mental issues. Oh, he did. And there are a lot of people like that. So I'm just telling you, be vigilant. Keep your eyes and ears open. So, moving on. If you have a business, a topic, or a new YouTube channel that you would like for me to discuss on YouTube or Blog Talk Radio, please email me at lej6521@gmail.com. And if you have a comment, please leave your comment in the comment section under the video. But make sure that your comments are pithy. No bloviating, pettifogging, or filibustering if you wish to opine. Now that's it for this video. Until next time, my name is Leon Jones. Remember, please be respectful and cognizant and conscious of each other. And also be understanding. Until then, have a wonderful and blessed evening. Good night.